The oral exam and the charting of abnormal findings is the foundation of veterinary dentistry. Each member of the veterinary team has an important responsibility to understand the essential elements of the oral exam, proper charting, and how this contributes to the overall health of the pet. Without proper oral exams and charting, the pets we see every day may be suffering quietly from the pain of periodontal disease, fractured teeth, or numerous other conditions that might go unnoticed or untreated without our thorough attention to detail. Charting the abnormal conditions of the mouth forces each of us to be consistent in our approach. This is essential because many of the dental diseases of pets go unnoticed by their owners, except perhaps halitosis, which many owners accept as normal. Animals will generally continue to eat, drink, and go about their days with little attention placed on the serious dental disease that might be occurring in their mouths. We can make a difference if we are willing to find, chart, and treat these conditions whenever possible. In this program, we will begin with how to conduct a thorough oral exam. It is here that we will make the observations and diagnoses. The second portion of this program will focus on dental charting. The oral exam. Step number 1. Taking a thorough history of the patient includes questions centered around their teeth. These include questions on diet, eating habits, indications of pain, behavioral changes, and increased attention to the head and face. Step number 2. Conduct a general health exam. For example, a dog's body condition may be a key indicator that the patient is losing weight, possibly the result of not eating from dental pain. Step number 3. The examination of the head should be done both before and after anesthesia in order to document findings in the dental chart. Before anesthesia, observe the breath for halitosis. Palpate the head and face for symmetry and the lymph nodes for enlargement. The sublingual lymph nodes drain the skin of the chin, the tip of the tongue, mandibular incisors, and lower lip. The submandibular lymph nodes drain the upper and lower lips, the palate, the body of the tongue, and all of the teeth except mandibular incisors. The following areas should be examined within the oral cavity. Begin by evaluating the bite or occlusion. Does the dog or cat have an overbite, an underbite, open bite, or normal bite? More examples of malocclusions are included in the following section on charting. Visually evaluate each tooth for the following: the presence of fractures, periodontal inflammation, missing, extra, or mobile teeth. If tartar is visible on the premolars, this might be viewed as a valuable educational opportunity for the owner. Clients generally only see the incisors and canines of their pets, and these may not exhibit the tartar and periodontal changes that the premolars do. The TMJ, or temporal mandibular joint, can be felt by moving the jaw while feeling just below the external ear canal. Note any pain or clicking upon movement of this joint. Step number 4. A thorough dental exam must be conducted with the aid of anesthesia. This involves 4 areas: checking the gingiva, checking for furcation invasions, periodontal probing, probing for depth and attachment loss. The hallmark of a thorough dental examination is the individual tooth inspection. Dogs normally have 42 teeth, and cats normally have 30. The systematic process of examining each tooth goes hand in hand with dental charting. Again, if possible, evaluate each tooth for movement. This can be done with a scaler or curette. Record movement using the following grading system. M1 indicates slight mobility, 1 millimeter or less. M2 indicates moderate mobility, 2 millimeters. M3 indicates marked mobility. Here, the tooth can be moved vertically as well as horizontally. Dental radiographs, though only briefly mentioned in this program, are essential to the overall dental evaluation. The result is adequate information for you to make an accurate diagnosis and treatment plan for each patient. Dental charting is the process of recording the many findings encountered in the oral exam. Though this process can be done with a variety of paper charts, paperless record keeping has developed to such a degree that paperless dental charting has become a practical and efficient way of recording all of the information into the patient's medical record. This will be our focus in the next section of this program.